Margaret was 72 when her daughter brought her to my office. She couldn't remember her grandson's name. 3 months earlier, she'd been sharp enough to beat me at chess during a hospital fundraiser. Now she stared at family photos like they were strangers. Her primary care doctor had called it early-stage dementia. I pulled her medication list and saw something else entirely. 5 different sleep medications. All of them prescribed in the last 18 months. All of them sitting in her system like poison. Here's what nobody tells you. The sleep medication your doctor handed you to fix 8-hour nights might be erasing decades of memories instead. Not someday. Right now. Tonight. While you sleep, these drugs are supposed to quiet your racing mind. What they actually do is flood specific receptors in your aging brain with chemicals that interrupt the exact pathways you need to form new memories and maintain old ones. The connection between common insomnia medications and accelerated cognitive decline in patients over 60 is not theoretical. It is documented. It is measurable. And it is happening in bodies that can no longer process these drugs the way a 30-year-old can. I am going to walk you through 5 medications sitting in medicine cabinets across this country. Medications prescribed millions of times every year to people your age. I will show you what they do to the aging brain. I will show you why the risks multiply after 60. And I will give you the specific information you need to have a different conversation with your doctor starting tonight. Stay with me. I've held beating hearts in my hands more than 2,000 times. I am a cardiothoracic surgeon. I have been in operating rooms for over 30 years. My work is the heart and the lungs and the vessels that connect them. But the brain? The brain is why I can no longer stay silent about what I see in post-operative recovery units. You want to know the fastest way to derail a successful cardiac surgery? Give a 70-year-old patient a benzodiazepine for sleep on night 2. I have watched patients who were sharp and conversational 12 hours after open-heart surgery turn confused and combative after a single dose of Ativan. The anesthesia didn't do that. The surgery didn't do that. The sleep medication did. The cardiology ward and the neurology ward share the same building at my hospital. We talk. We compare notes. And what the neurologists tell me keeps me awake at night more than any pages from the ICU ever did. They are seeing memory disorders and dementia diagnoses in patients who have one glaring common factor. Chronic use of sedative hypnotic medications started after age 60. Not 5 years of use. Not 10. Sometimes 18 months is enough. These are not fringe opinions. These are findings published in JAMA, in the British Medical Journal, in neurology journals that hospital systems ignore because changing prescribing patterns is harder than writing another script. Your body after 60 is not the same machine it was at 40. Write that down. Your liver metabolizes drugs more slowly. Your kidneys clear medications from your bloodstream at half the speed they once did. The blood-brain barrier, the protective wall that keeps toxins out of your brain, becomes more permeable with age. It lets more through, and your brain has less reserve capacity to recover from chemical interference. When you take a medication that suppresses brain activity to force sleep, your 65-year-old brain absorbs more of it, holds onto it longer, and has fewer resources to repair the damage it causes to synaptic connections. This is not about willpower. This is basic pharmacology in an aging system. Here is the analogy that makes it clear. Imagine your brain is a library. At 40, you have a full staff. Books get reshelved quickly. Damage gets repaired overnight. New information gets cataloged and stored in the right section. At 70, you are running that same library with half the staff and a roof that leaks. Now someone comes in and starts pulling books off the shelves randomly, filing them in the wrong sections, and disconnecting the card catalog system. That is what sedative hypnotic medications do to the aging brain. And the statistic that should terrify you. A 2015 study published in the British Medical Journal followed over 9,000 patients and found that those who used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease. Let me show you the 5 most dangerous offenders. Each one has a different mechanism. Each one carries a different risk profile for your brain after 60. And each one has a specific alternative that your doctor may not mention unless you ask. Ambien, Zolpidem, the most prescribed sleep medication in America. 15 million prescriptions written every year. It works by amplifying the effect of a neurotransmitter called GABA in your brain. GABA is your brain's brake pedal. It slows neural activity. It quiets the noise. Ambien floods your GABA receptors and forces your brain into a shutdown state that mimics sleep. Except it is not real sleep. It is sedation. Your brain never enters the deep restorative stages where memory consolidation happens. You lie unconscious for 7 hours and wake up more cognitively impaired than when you started. The risk after 60 is this. Ambien has a half-life of 2.5 hours in a young, healthy adult. In a 70-year-old, that half-life extends to 4 or 5 hours because your liver is slower. The drug stays active in your system longer. It accumulates. Patients tell me they take Ambien at 10 p. I'm Shuams and feel groggy until noon the next day. That is not a side effect. That is your brain still being suppressed 12 hours later. The neural pathways responsible for short-term memory formation are offline. You have conversations you will not remember. You make decisions with impaired judgment. And if you take this medication nightly for 6 months, you are rewriting your brain's baseline. It forgets how to produce natural sleep. It becomes dependent on the drug. I had a patient named Richard, 74 years old, retired engineer. Started Ambien after his wife passed. Took it every night for 2 years. His son brought him in because Richard had gotten lost driving to the grocery store he had shopped at for 30 years. We ran cognitive tests, significant short-term memory impairment. I pulled the Ambien. Within 8 weeks, his memory function measurably improved. Not fully restored, but improved. That is how fast the brain can start to recover when you stop poisoning it. Here is what you do instead. Ask your doctor about cognitive behavioral therapy for insomnia. CBTI. It is a structured program that retrains your brain to sleep naturally without drugs. It works better than Ambien in clinical trials. It has zero risk of dementia, and it actually addresses the root cause instead of masking symptoms. If your doctor has not heard of CBTI or says it is not available, find a sleep medicine specialist who offers it. It exists. It is covered by most insurance. You just have to ask for it. Now let me tell you about the medication class that makes me angriest. Benzodiazepines, Ativan, Xanax, Clonopin, Valium. These drugs were never designed for long-term use. Never. They were developed for short-term acute anxiety and seizure disorders. Somehow, they became the go-to prescription for chronic insomnia in older adults, and the damage is catastrophic. Benzodiazepines work the same way Ambien does. They amplify GABA, but they do it more aggressively and across more receptor subtypes. They do not just sedate you. They suppress the entire central nervous system. Your brainstem, your hippocampus, the prefrontal cortex, all the regions responsible for memory, executive function, and emotional regulation get bathed in a chemical that tells them to shut down. In a younger brain, this effect wears off in hours. In a brain over 60, the drug lingers for days. Here is the mechanism of harm. Benzodiazepines prevent your brain from entering REM sleep. REM is where your brain processes emotions and consolidates memories. Without REM, you lose the ability to integrate new information into long-term storage. You also lose the nightly emotional regulation that keeps you psychologically stable. Patients on chronic benzodiazepines do not just develop memory problems. They develop personality changes, emotional blunting, loss of motivation. These are not depression symptoms. These are direct neurological effects of the drug. The age-specific risk is this. After 60, your brain has fewer GABA receptors to begin with. When you flood the remaining receptors with benzodiazepines, night after night, your brain down-regulates them even further. It tries to protect itself by reducing receptor density. Now you need higher doses to get the same effect. This is tolerance. This is dependence. And when you try to stop, your brain has so few receptors left that you experience withdrawal symptoms that can include seizures and hallucinations. I have seen 70-year-old patients who cannot stop taking Ativan without medical supervision because the withdrawal is life-threatening. Write this down. If you have been on a benzodiazepine for more than 4 weeks, do not stop it on your own. You need a slow, medically supervised taper, but you absolutely need to stop. A 2014 study in BMJ tracked patients for up to 20 years and found that benzodiazepine use for more than 6 months increased dementia risk by up to 84%. 84%. That is not a marginal risk. That is a direct pharmacological assault on your brain. The patient resolution from earlier, Margaret, was on Ativan, Ambien, and Trazodone simultaneously. 3 different sedatives. Her doctors had layered them on one at a time when the previous drug stopped working. Nobody had ever tried to take her off any of them. I tapered her off all 3 over 4 months. Her memory did not return to baseline. The damage was done, but she stopped declining. Her daughter sent me a note 6 months later. Margaret remembered her grandson's name again. Here is what nobody tells you about the 3rd drug on this list. Actually, let me stop here, because I need to say something I have been avoiding. I know some of you are listening to this and thinking, my doctor would never prescribe something that dangerous. My doctor cares about me. I trust my doctor. I want you to hear me clearly. I am sure your doctor cares. I am sure they went to medical school intending to help people. But the system they work inside is designed to move fast and prescribe solutions. 15-minute appointments. Metrics that reward prescription rates. Pharmaceutical reps who visit with samples and studies funded by the companies selling the drugs. Your doctor is not intentionally harming you, but they are operating inside a structure that prioritizes symptom suppression over root cause resolution. And when it comes to sleep medications in older adults, the guidelines most doctors follow are decades out of date. I have stood in operating rooms with families waiting outside. I have walked into those waiting rooms after a successful surgery and watched relief flood across their faces. And I have also walked into those rooms after we could not save someone and watched the same faces crumble. Do you know what I think about in those moments? Information. The information they did not have 6 months ago. The conversation that never happened. The medication list that nobody questioned. Sleep medications are not what kill you on the operating table, but they are what make your brain too fragile to recover. They are what turn a routine surgery into a cognitive disaster. And nobody told you. That question has stayed with me. Let me finish the list. Trazodone. Doctors love prescribing this one because it is technically an antidepressant, not a controlled substance. It feels safer. It is not. Trazodone was developed to treat major depression in the 1960s. It failed. It made people so drowsy that it was repurposed as a sleep aid. Think about that. A drug that failed at its intended purpose is now prescribed to millions of older adults every night because the side effect is useful. Trazodone works by blocking serotonin receptors and histamine receptors in your brain. This creates sedation, but it also disrupts the normal serotonin signaling your brain needs for mood regulation and cognitive function. In patients over 60, trazodone causes orthostatic hypotension. Your blood pressure drops when you stand up. You get dizzy. You fall. Hip fractures in older adults are not minor events. They are life-altering. A 2019 study found that patients over 65 on trazodone had a 28% increased risk of falls compared to those not on sleep medications. But the brain risk is worse. Trazodone has anticholinergic properties. That means it blocks acetylcholine, the neurotransmitter essential for memory and learning. Every night you take trazodone, you are chemically interfering with the system your brain uses to remember what happened today and retrieve what happened yesterday. Do this for a year, and you have measurably increased your dementia risk. A University of Washington study published in 2016 found that anticholinergic medications increase dementia risk by 54% in patients who use them for more than 3 years. The alternative here is melatonin, not the gas station version. Pharmaceutical-grade melatonin at the right dose, taken at the right time. Your doctor should be testing your cortisol and melatonin levels before prescribing anything. If your natural melatonin is low, supplementing it at 0.5 to 3 milligrams 2 hours before bed can reset your circadian rhythm without touching acetylcholine or serotonin receptors. It is not a sedative. It is a signal. And it works. Antihistamines, Benadryl, Unisom, doxylamine, over-the-counter does not mean safe. These drugs are in every pharmacy. They are marketed for allergies and insomnia. And they are destroying cognitive function in older adults at a scale that should be a public health emergency. Antihistamines work by blocking histamine receptors in your brain. Histamine keeps you awake and alert. Block it and you get drowsy. But histamine is also critical for memory formation and attention. When you block it chronically, you impair both. The mechanism of harm is the same as trazodone, anticholinergic activity. Benadryl is one of the most anticholinergic drugs available without a prescription. In older adults, it crosses the blood-brain barrier easily. It accumulates. Patients take it nightly for months because it is cheap and accessible. And their brains are being soaked in a chemical that degrades the exact neurons responsible for memory. A 2015 study from Indiana University followed over 3,000 older adults for a decade. Those who used anticholinergic medications regularly had a brain volume on MRI scans that was measurably smaller than non-users. Smaller hippocampus, thinner cortex. These are the structural changes seen in Alzheimer's disease. The drug was causing the brain to physically shrink. If you are using Benadryl for sleep, stop tonight. If you need an antihistamine for allergies, ask your doctor about non-sedating options like Zyrtec or Allegra. They do not cross the blood-brain barrier. They do not have anticholinergic effects, and they will not erase your memories while you sleep. The fifth medication is one you might not expect, Seroquel, quetiapine. It is an antipsychotic. It was developed to treat schizophrenia and bipolar disorder. And somehow, it became a common off-label prescription for insomnia in older adults. This is medical insanity. You do not use a sledgehammer to hang a picture frame. Seroquel works by blocking dopamine receptors and serotonin receptors across multiple pathways in your brain. It sedates you by essentially shutting down large sections of neural activity. The side effects in older adults include severe metabolic dysfunction, weight gain, diabetes, cholesterol problems, and a condition called tardive dyskinesia, which is involuntary muscle movements that can become permanent. But the cognitive effects are what concern me most. Seroquel impairs executive function. It slows processing speed. It disrupts memory consolidation. And in patients over 60, it has been linked to increased mortality, not just dementia risk, death. A 2016 analysis published in the American Journal of Psychiatry reviewed antipsychotic use in older adults and found that off-label use for insomnia increased mortality risk by 54% compared to non-use. 54% for a sleep problem. There is no scenario where that risk-benefit ratio makes sense. If your doctor prescribes Seroquel for sleep, you need a second opinion. Not next month. Now, the alternative is addressing the root cause of your insomnia. Sleep apnea, restless leg syndrome, chronic pain, anxiety disorders. These are medical conditions that require proper diagnosis and treatment. A sedative is not treatment. It is avoidance. Let me bring this together. You have a brain that has worked for you every single minute of your life without rest. 70 years, 80 years. However long you have been alive, your brain has been managing your heartbeat, your breathing, your memories, your personality, your ability to recognize the faces you love. It has never stopped. And now we are telling you to flood it with chemicals that suppress its function because you cannot fall asleep. That is not medicine. That is surrender. Here is what you do starting tonight. 1. Make a list of every medication you take, prescription and over-the-counter. 2. Schedule an appointment with your doctor specifically to review that list. Not a quick check-in. A dedicated medication review. 3. Ask these exact questions. Is this medication appropriate for my age? What is my dementia risk if I stay on this long-term? What non-drug alternatives exist for my condition? 4. If your doctor dismisses your concerns or says these medications are fine, get a second opinion from a geriatric specialist. They are trained in age-appropriate prescribing. Your primary care doctor may not be. 5. Advocate for yourself. You are not being difficult. You are being informed, and it is never too late to stop a medication that is harming you. Margaret was 72 when I took her off 3 sedatives. Her brain did not fully recover, but it stopped deteriorating. That is worth fighting for. I want to hear from you. What medication are you currently taking for sleep? Write it in the comments below. If you have noticed memory changes since starting a sleep medication, share that too. This is not about shame. This is about information. And the more we talk about this openly, the harder it becomes for the system to ignore. If this video gave you information your doctor never mentioned, share it with someone who needs it. Your sister, your father, your neighbor who complains about brain fog but keeps taking Ambien. They deserve to know what you just learned. And if you want more content that exposes what the medical system is not telling you about aging and medication safety, subscribe to this channel. I am not going anywhere. I am just getting started. One more thing. I am a surgeon. I am not your personal physician. Nothing in this video is individualized medical advice for your specific situation. Do not stop medications abruptly without medical supervision, especially benzodiazepines. Work with your doctor. Get proper guidance, but do not stay silent. Your brain is depending on you to ask the hard questions, and you are the only one who can do that.